Hi, I'm Laura. I'm the occupational therapist on cardiac vascular surgery and the CVICU.
And I'm Kristen. I'm the occupational therapist for the wound care team.
And we're here to talk to you today about different mattresses and pressure redistribution versus offloading. So the first principle is offloading versus pressure redistribution. Offloading is when you are physically off the surface. So think about standing, you are physically off of your sacrum. Anything else is pressure redistribution. So if we're turning patients, or we're having them sit on a cushion or a positioning roll that we're turning them with in bed, all of that is redistributing the pressure. It's not offloading the pressure. Offloading is the best possible thing for their skin, but many patients can't be off the surface for a long period of time, and that's why we want to make sure that we get them the right mattress, the right equipment, the right turning schedule to maximize their skin integrity and prevent a negative outcome.
And so we're going to be talking about our therapeutic services that we have here at St. Mike's. And the good thing to know is that all of our mattresses are considered therapeutic and can help with wound healing as long as you have the right mattress for the right patient.
And the main thing to note as well, the best mattress in the world is not going to necessarily prevent pressure injury. We want to make sure we're still turning them every 2 hours, even though some of the mattresses do have the ability to turn the patient. As long as the patient is medically stable enough to be turned, we need to turn them every 2 hours to help prevent further injury or breakdown. So the first mattress we wanted to review today is the ISOFlex. Many years ago, our standard mattress was high density foam, and we had to call to upgrade to this therapeutic surface. Then corporately, we made a decision to have all the mattresses be the ISOFlex mattress because it is a really great therapeutic surface. It's gel on the middle of it, and then it's a foam around the edges. Because we've had these mattresses for a while, some of them do have wear and tear. So if you have a patient that is complaining of discomfort on their sacrum, it might not necessarily mean that they need a different mattress. They might just need a different ISOFlex. So turning them more, getting them up more if you're able to. But if you're noticing that there's an indentation here by the sacrum, probably is due to wear and tear, and then you would just switch it for a different ISOFlex and then notify clinical equipment to have them just be aware that that mattress may have seen the end of its shelf life. The other thing to note is it's really important to read the foot of the bed for the actual type of mattress. So the ISOFlex, this one is silver. We have a maroon colored one. I believe we have blue coloring as well. Some of the other mattresses, some of the air mattresses are maroon or blue, so it's really important to read what's on the bed to know what kind of mattress the patient is on. On this mattress, you're going to use a regular bed sheet. If your patient has skin breakdown, any patient, if they have skin breakdown and you're worried about their skin, don't use the green lifter pads. Use the white UltraZorbs pads on both their cushion and on their mattress. Because the green pads are too thick, so it doesn't allow the mattress to do its job effectively at pressure redistribution. This next mattress is our Rick mattress. It's gel based, so think toothpaste-like consistency. It's great because the patient can really immerse and envelop into the mattress. It's great for different patient populations, including the vascular patient population, great for patients with cognitive impairments, with skin integrity issues. The main thing is you have to use a loose sheet on it, and then the magnets on the side are how you attach the loose sheet. So if I took this off, you would see what it looks like. You cannot put a fitted sheet on this mattress, otherwise the patient won't be able to properly immerse, and that'll cause increased pressure on their sacrum. So this is another alternative. So the next mattress we're going to focus on is the Progressa. It is an air mattress. The pump is underneath the mattress, so you don't actually physically see it. You'll have to make sure that you plug the mattress into the wall. If there is a power outage, the mattress will deflate, and you want to make sure that it's plugged into the red outlet so that it does not have your patient lying on a harder, flatter surface.
So it's useful to know that if you are having to unplug it for a short period of time, let's say for transferring a patient to another unit, it will maintain its air inflation for a short period of time. So you don't need to worry about them sitting on the metal surface or the pan of the bed.
The main thing to note with the air mattresses is that there should not be any sheets on the bed. Wound care team recommends no sheets, and you would just use the Ultrazor pad. So I brought one here. You can use 2 Ultrazor pads, that's fine, and just make sure that there's not a lot of overlap or folds in the lifter pad. You would never use the green soaker pad on any patient that you're worried about their skin, because it's so thick it defeats the purpose of the mattress. The patient cannot properly immerse into the cushion or into the mattress. You would also never use these blue and white sheets. They're non-breathable, so that'll increase the patient's moisture, which will cause decreased skin integrity or more skin breakdown. So you would never leave one of these underneath a patient. It is just for a fluid-based procedure, and then you would throw it out. With regards to incontinent briefs, we try to advise patients to never wear them 24/7. Ideally, we don't want them to wear them in the mattress either. It's not good for their skin if their skin cannot breathe, and we tend to see more issues with skin breakdown when a patient is wearing a brief all the time or much of the time. The only time we actually recommend wearing incontinent briefs is when the patient is on the cushion, and that is to help protect the cushion. Because if our cushions get soiled, sometimes they can be cleaned, sometimes they can't. The cushions range in price from $700 to $1,200, and if they can't be cleaned, it's thrown out, and the patient will then not have a cushion to sit on because we are short on some of our cushions. If you have a patient who's incontinent or they have C. diff precautions and there's a lot of feces, if you can, give them a break during the day so they're not wearing the brief 24/7 and using a couple Ultrazor pads to help absorb, and then wearing a brief at times, but really, really try to make sure that they're not wearing it 24/7 because it is really bad for their skin, and the acidity from the urine and the feces could actually cause what looks like a chemical burn on the skin. So we try our best to prevent because that's easier than to treat. The next thing we wanted to say is that this mattress can partially turn the patient. Some of our air beds do turn the patients. No matter what, we still need to physically turn the patient. The best mattress in the world is not going to be able to turn a patient as well as we can, and their skin will absolutely break down on a turning mattress because they're not able to offload. So still turning the patient every 2 hours during the day is the usual recommendation, with either the positioning rolls, the wedges, or pillows. So the next 2 things I wanted to talk about is the mattress can actually expand on this frame, so it can accommodate a 7-foot tall patient, so you do not have to necessarily switch them to a different bed. You can use the buttons to extend the mattress to accommodate your patients. One thing we do recommend is to elevate the legs first and then the head of the bed last, if your patient can tolerate it. If you elevate the head first while the legs do raise up, the patient still slides down, and that causes more friction and shear on their sacrum, which is really bad for their skin integrity. When you're immobilizing your patient, you want to have this bed on max inflate. It will recalibrate after 30 minutes, so if you forget to take it off max inflate, that is okay. But you want to max inflate them so that they're sitting on a more stable surface. Because it's an air bed, it will be unstable, and the types of patients that generally need these mattresses may not have the core strength or the balance to be safe, and you don't want to put them at higher risk for a fall. And lastly, when you are putting them back into bed, they actually have an image here to align where the patient's hips should be before you help lower them back into lying position. This is our newest low air loss mattress. It's the ISO Air. Unlike the other mattresses, this mattress name is written on the side by the foot of the bed. The 2 main things you have to remember with the ISO Air is to plug in the bed and plug in the pump. Make sure you can hear the pump, the air flowing through the pump. If you cannot hear the air flowing through the pump, then it is not working properly. So then you would contact clinical equipment, or you would contact your nurse educator, or you can contact the vendor. Those are the 3 main people you should be contacting if any of the mattresses are not working properly. You would be holding the on button for 3 seconds, and then you should see it.
As with all of our air mattresses, it's really important to minimize the layers, and so no sheets are placed on this bed especially our low air loss mattresses, because we want the airflow to come through the cover to the patient's skin to help with moisture management. So only using the Ultrazorb pads underneath any of the patients on our air mattresses.